I'm Dalton Wolfe, and I work at the Lawson Health Research Institute. We have a research center there that is embedded in Parkwood Hospital in London, Ontario. And so I get the opportunity to work right in the front lines with clinicians and other researchers that work in spinal cord injury. Essentially, everything is guided by how to best mobilize knowledge into practice. So in particular, though, we're looking at how technology can play a role in implementing best practice into, especially in the rehab, but also in the community sector for improving the lives of persons with spinal cord injury. There's a science behind implementation, how to best change practice. And a specific example is a program that we have called the Internet Pressure Ulcer Clinic. So for example, we examine current practices about assisting clinicians and persons with spinal cord injury as they deal with pressure ulcers and figure out the best model of care for that situation. And we use technology and especially internet-mediated technologies to enhance care delivery for persons that are dealing with pressure ulcers. There's one of the fundamental issues that we deal with is that people with spinal cord injury go to specialized centers, and in rehabilitation there's about 15 specialized centers across Canada. They leave that sort of protected environment, go back to their communities, and all of a sudden they don't have easy access to the services and the specialized care that they had in the early days after their injury. And so many people in the community don't necessarily know the best practices in dealing with those situations. In some cases, the patient is on their own, or the person with spinal cord injury is on their own. And so via internet, it allows us the opportunity to provide that connection with specialized care in the person's home, which also is another important feature is that people with spinal cord injury often have barriers and challenges in terms of transportation. So getting the service delivered into their home via internet overcomes that barrier. But it is right now running in a study where we have controlled access to only the study participants. And essentially we're bringing together home care workers with specialized care providers in centers. We're actually doing this across 4 centers across Canada, and every center has a different workflow. So some people have connected with home care agencies, others have nurses from an institution that they send out into people's homes. Other groups have found that it's important to connect with people that provide attendance services. And they bring those into the equation in terms of dealing so that everybody has the same information in terms of when they're helping a person deal with pressure ulcers. This is actually one of the unique challenges of doing a research study like this, in that most research studies are very controlled. And so it's been a mind-enhancing experience for many of the people that have been involved in this project. It's still, not completed yet, so we're still working through things. But unlike a controlled situation, this is one where we're trying to tailor what is happening into the context of each site, so that each site can do what's best for their own context. Very important in terms of implementing practice. You need to implement relative to the local environment. There's a lot of learning that still needs to be done. There's a lot of issues to overcome, but the long-term vision is exactly that. We really need to apply these technologies that overcome barriers. It's not only about getting into persons' homes and making things easier for them in terms of care delivery, but it's issues of how to see people faster and overcoming access issues. So this has application across not just spinal cord injury, but all kinds of indications as well. The overall theme of our work is mobilizing knowledge into practice. And one of the key pieces of that is a project called SCIRE, which stands for SCI Rehabilitation Evidence. And that is, in essence, a distillation or a synthesis of a very comprehensive approach to looking at all the evidence that exists for, first and foremost, spinal cord rehab, but also evidence that exists for different treatments and assessments that are applied in the community or in the acute setting as well. And really what this acts for is a platform. So by bringing the evidence all into one place, people that are producing guidelines or sort of knowledge products that might be used in other projects, they can go to this resource, which is a website on www.skyerproject.com. Go to this website, use this freely accessible resource to produce applications that allow that mobilization of knowledge into practice. The other thing actually that's really important about that is that what it does is it brings our SCI community together. So we have about 70 people across Canada that are experts in one area or another, and they assist in the process of writing the chapter, which actually serves a chapter of their interest, which actually serves two purposes. It not only brings people together, but it also increases the likelihood that each of these people will incorporate sort of the latest evidence in their own environment and their own practice. Really, the most important thing is to understand and appreciate that although telehealth has had a lot of promise, and then there's been some missteps along the way in that we haven't figured out how to correctly implement it, there's still that promise exists, and we really need to fight past some of those barriers because the benefits are actually quite extraordinary. And that's really the fundamental message.